My name is Amber May. I am in the public health major and I'm doing my presentation on Alzheimer's disease. Alzheimer's disease is the leading cause of dementia in the elderly. This is a progressive degenerative disease which causes deterioration of brain cells. As a result, people with Alzheimer's experience an impairment in cognitive functioning such as loss of memory and inability to comprehend and use words, as well as impairment in physical functioning such as coordination and gait. This disease usually causes death within 12 years of the onset of symptoms. National mortality rates indicate that over 50,000 Americans die each year from Alzheimer's, and in 2000 it was the seventh leading cause of death in men and women aged 65 and older. An estimated 5.2 million people have Alzheimer's, and women comprise 2/3 of the total Americans who suffer from this disease. In North Carolina alone, morbidity rates of Alzheimer's are currently projected to be 28.6%. No one knows the exact cause of Alzheimer's. However, it is believed that a combination of genetic, environmental, and lifestyle influences work together over a long period of time to produce the changes in the brain that leads to this disease. Even though age is the greatest risk factor, age alone does not cause Alzheimer's. Studies have shown that people who have more than one first-degree relative with Alzheimer's are at a greater risk than others, and many believe that environmental factors such as aluminum and viruses are causative links. Lifestyle choices such as smoking and lack of consistent exercise are also believed to be contributing factors in the onset of Alzheimer's. The primary care physician is normally the person who provides a diagnosis of Alzheimer's. Symptomatology is examined, such as poor memory, loss of cognitive ability, changes in gait, and coordination. The physician will obtain a medical and family history and also receive input from family and friends as to their observations of the person's degenerative abilities and functioning ability. Brain imaging techniques such as MRIs and PET scans are used to look at the brain to determine neuron and synapse functioning, brain size, and to rule out other medical diagnoses. There is no known cure for Alzheimer's. However, the symptoms can be controlled to some degree. The FDA has approved 5 different medications for the treatment of Alzheimer's, all of which help with cognitive functioning. At times, cognitive and behavioral therapy is helpful in assisting with Alzheimer's patients live a more normal life. Researchers continue to work to find a cure for this disease and to identify possible preventative measures which would prevent the disease from developing. Stem cell research has provided some promising indicators in the area of prevention and even reversal of Alzheimer's. Healthcare professionals recommend that adults engage in active learning activities such as crossword puzzles, Sudoku, and certain video games, as well as maintaining a physical exercise routine in an effort to reduce the risk of Alzheimer's development. The following 3 slides show the references that I used to complete my research.